The November 3rd, 2025 Auburn City Council workshop will be called to order. The first item on the workshop agenda tonight is a syringe service program. As background for the public and refresher for the council, we implemented a 6-month moratorium on syringe service programs in Auburn that runs into January. The basis of that was given the legislative changes and the ongoing rulemaking at CDC to make sure that we did not have a syringe service provider licensed in Auburn start operating and then in a month or two change their operating guidance. As we previously discussed and as the council requested, as we take up the potential drafting of a ordinance related to syringe service programs, there was a request to make sure that we were providing sufficient educational background and data relative to the SSPs, and that's where we'll start tonight. So the way I see this rolling out is this evening we're going to have some presentation around the legal framework, some of the information regarding the public health basis for the SSP policy and harm reduction and the current state of SSP services in Maine. We'll have some further discussions at the next meeting, and then a discussion amongst the council about the policy areas to include in potential ordinance. So with that, I think the first presenter is going to be Mr. Stockford, City Legal, to provide some legal framework regarding the SSP programs.
Great. Thank you, Mr. Mayor. As indicated, I wanted to cover the legal and regulatory environment that exists with respect to syringe service programs in Maine, and talk a little bit about the role municipalities may play under the existing legal framework in regulating those programs. The state adopted a statute almost 30 years ago addressing hypodermic apparatus exchange, and that statute was followed up by rulemaking, and the statute allowed the Maine Bureau of Health to certify the hypodermic apparatus exchange programs, and it was fairly limited. The statutory framework was fairly limited, but it had the elements of requiring collection and tracking of data regarding the number of syringes distributed and collected by SSPs, then called hypodermic apparatus exchange programs. The statute emphasized harm reduction, including safe disposal of syringes, and also required and provided for drug abuse prevention and treatment education in connection with the exchange of syringes. And the legislative focus at that time was primarily on public health protection, and focus was not so much on drug decriminalization. Over the past 25, 30 years, there have been shifts in the state of Maine's approach to these matters as the opioid crisis has continued to be a factor that we face. And in 2021, the legislature made a number of amendments to Maine law that decriminalized purchase, possession, and residue in syringes. These changes represented a shift in focus from law enforcement to public health intervention. And in 2022, the Maine CDC adopted updated rules applicable to syringe service programs and just recently issued a proposed update to those rules. The rules include statewide standards for registration of programs, operational standards for programs, reporting and harm reduction education requirements, disposal and safety protocols. The rules codify operational standards and educational obligations, and again, the emphasis is on public health education as an integral part of all SSP activity. The history of the statute and the rules have demonstrated quite a bit of focus by the state on policy issues surrounding these programs, and the legislature has continued to drive the policy discussions and considerations around that. Earlier this year, there was a proposal that the Maine legislature adopt a one-for-one exchange mandate rather than the current 100-to-1 limit that is prescribed by rule. And the legislature ended up rejecting that change in the law. And so the current state of the law continues to allow limits on exchanges up to 100-to-1. So just to summarize sort of where things stand from a regulatory perspective, Maine CDC under Title 22 and the related rule regulates all operations of syringe service programs. Programs must be certified by the Maine CDC to operate legally. Programs must require consumers to enroll in order to receive services. Programs are prohibited from knowingly providing syringes to anyone under 18. Programs are required to adopt and adhere to specific policies and have a extensive policies and procedures manual that govern their operations. Programs are required to follow rules regarding safe collection and disposal of used syringes. Programs are required to take steps to protect the confidentiality of participants. Programs are required to regularly report data to the Maine CDC. Programs must train their staff in confidentiality, infection control, and other relevant areas. SSPs are required to provide education and referrals for substance use disorder treatment, HIV and viral hepatitis testing and treatment, and other social services. And a number of updates to the rules have been proposed and are currently pending approval. The proposed updates to the rules provide for programs to operate mobile sites and provide delivery services. They would allow establishment of a defined operation area for each program. The rules would prohibit operation of an SSP within 1,000 feet of a school property. The rules would require SSPs to present evidence that they are in compliance with municipal zoning ordinances. And there are also some enhanced enforcement provisions available to the CDC, allowing unannounced inspections and requiring that the department be allowed full access to all related records and documents held by an SSP. As the council and the city look at proposed ordinances, just to provide an overview of some of the legal considerations, under home rule, municipalities generally are allowed to exercise powers that the legislature has the authority to confer and that aren't denied either expressly or by clear implication under state law. So any local ordinance addressing SSPs has to be consistent with state law and cannot frustrate the purpose of any state law. So what does that mean? Land use and zoning related to location and hours of operation are permissible under the law from a municipal perspective, so long as they're not discriminatory. The city would be free to provide by ordinance for coordination with public safety and address issues like disposal containers and education related to law enforcement. And the city would be permitted to promote local partnerships for educational outreach and public information. Those are some of the areas that would be perfectly permissible for an ordinance. As far as restrictions on municipal action, we don't have case law in Maine as to the scope of, specific to the issue of what municipalities may do with respect to these particular programs. One issue would be whether blanket prohibition of SSPs or limitation on the number of SSPs within a municipality is permitted. As I said, there's no case law on that issue, but there could be, if a municipality attempted to prohibit SSPs from operating at all within a municipality, that could be subject to challenge, either based on home rule arguments or other legal theories such as the Americans with Disabilities Act. Generally, the city would be prohibited from adopting licensing requirements that are contrary or frustrate the purpose of the CDC licensing and certification requirements. So any ordinance considerations should take that, keep that in mind and take that into account in developing any proposed ordinance. And the city would be prohibited from, taking action that, is contrary to state law with respect to public health programs and the syringe service program rules that are in effect. So it's important that we would work together in tailoring any proposed ordinance measures to ensure that they don't run afoul from the limitations on municipal authority in this area. So just by way of conclusion, the bottom line is state law generally is what controls syringe service programs authorization and certification in Maine. municipalities can regulate things like location, coordination with law enforcement, education, provided that those ordinances are reasonable. I would expect that over the next few months, as the council works through this, that our office would be working with the city staff on making sure that home rule and preemption boundaries are observed, that we properly take into account the interplay between municipal ordinance and existing law, and that we address issues like liability protections for municipal partners or host facilities as the city works through those issues. So that's just a brief overview. And, if there are any questions, I'd be happy to take them. If not, I'll turn it over to the people who I'm sure you're most interested in hearing about, the public health professionals on the ground. So.
Thank you, Mr. Stockford. Any questions from the council? Councilor Geary.
Thank you, Mr. Mayor. Could you please give the acronym that you were saying about SSPs, what exactly it stands for, so those at home can have a clearer understanding what you're talking about?
So a syringe service program is what the state has chosen to call programs that offer clean syringes to individuals who have a need for them. And the important service that SSPs provide is to promote public health by discouraging use of used syringes and doing that by making clean syringes available at no cost.
Thank you.
Any other questions from the council? Not seeing any. Thank you very much, Mr. Stockford. I'm sure we'll be having some further discussions with you as we draft an ordinance. The next two presenters are Gordon Smith. Gordon is Maine's Director of Opioid Response, and Ann Seitz, who's the Director of the Infectious Disease Prevention Program, Division of Disease Surveillance at CDC. You're welcome to come up to the table. If you sit at the two seats on this end, you don't have to push the button on the microphone.
Thank you, Mayor Hammond and members of the council. I'm Gordon Smith, and really delighted to be here with Ann Seitz. I think Ann still is in Leeds. And I grew up in Winthrop and graduated at East Winthrop, so we feel we're local to Central Maine. My dad used to have a store in this very space called Wilson's Dollar Stores. Most of you look young enough that you might not remember the store, but the store was here from right in this space. And then I think it was maybe an office supply store after that. But Wilson's was here from the 1940s to the early 1970s until the malls came. And you really didn't want to talk to my dad about the malls and the impact on downtown shopping. And but we would come here from the warehouse in Winthrop, drive around the back of the store, right where your garage is now, unload the truck, and then we'd generally go to Norway, where we also had a store. And it was, it's just very comfortable to be here. It's kind of sacred space for me. I'm going to give you just some general remarks. I appreciate Mr. Stockford's talk. I am a lawyer myself, but I don't really function in the governor's office as a lawyer. And I'm not going to give you a lawyerly talk. Ann really has some terrific slides to take you through the details. A lot of that comes from the 2024 annual report. The programs all give us a report each year, and that report goes to the legislature. So first, I just wanted to thank you for the invitation. We're not here to be advocates tonight. We're here as a resource to provide you with information. We're not here to push you one way or the other. We've spent a lot of time in Sanford with the council, in Lewiston with the council, in Bangor with their council, and those have really been the only 4 municipalities, frankly, that have been involved with ordinances. I think it's important for you to realize that for the first 25 years of our programs, and now I think we have about 20 sites right now, perhaps. We'll get right into that when Ann goes through her slides, but it was not common. In fact, I don't know of a single municipality that enacted an ordinance regarding our programs until Sanford did, maybe a year and a half ago. So this is a fairly new phenomenon, frankly, but it's certainly permissible under home rule. And in all of the cities we've been to, I always try to deliver the message from the governor is that we're here to work with you. We are very concerned that our programs have support, and we realize how damaging it is to all of our efforts if a young family believes they can't go down to local municipality or go out on a trail because it's either going to be people using or they're going to find improperly discarded syringes. So we're very sensitive to that topic, and there needs to be a real balance between, not and we'll get into why we don't want people to reuse syringes, but obviously we don't want people infecting other individuals, and at the same time we want our downtowns in Maine to be attractive places that people can visit. Okay, I'm almost done. I just wanted to put the syringe program and our harm reduction programs, which are largely the syringe programs and naloxone distribution. Frankly, those would be the primary things we do that try to keep people safe and alive. But it's also just one piece, it's one pillar of a very comprehensive program that Governor Mills established in 2019. So we are about 7 years into this program, and my position as the Director of Opioid Response in her office was part of that program. And the 4 pillars are prevention. You wish you could take all of the resources we have and do primary and secondary prevention so that fewer adolescents start down that road. Because, frankly, addiction is an adolescent onset disease. Many people in this room would have family members or colleagues or friends from work who have people who are suffering from a substance use disorder who have died of an overdose. We've probably had 5,000 deaths in the last 10 years or so. So almost no one anymore is completely, unknowing of how serious the problem is. So again, when I talk to people in recovery in their 20s, their 30s, I always say, when did you tell me your story? And what I hear is that we should have identified these situations when they were 9, 10, 11, 12 years old. It all goes back to trauma, childhood, families, everything, all the social issues that you're familiar with, childhood poverty, lack of housing. So prevention, again, you wish, it's very, very important that fewer people start. Treatment, well, let's go harm reduction, then treatment. We have established much more treatment than we did. We're getting a lot of treatment now at St. Mary's. You don't have to go through their emergency department anymore to get into their detox unit. Deb York's opened up some treatment for women over in Mechanic Falls. There's a lot more treatment available. And then finally, recovery support, recovery centers, recovery residences, recovery coaches, all forms of, because we really want to support people in their recovery for their lifetime. Syringe programs are not just about syringes. And that's a very important thing that we want to leave you with tonight, is that it's about connecting. Individuals, don't just walk in and be handed 100 needles. By the way, many of our programs, while you can distribute 100 needles, many of our programs still operate on a one-to-one basis. You bring in one syringe, you get one syringe. Others do 50. And sometimes it's an issue of supply. And 100 was a compromise between those interests, including the World Health Organization and the federal CDC at that point, who actually argue for a needs-based program where you simply have enough syringes available to give whatever the individual says they need, versus those people that really wanted to stay at one-to-one. So this was a compromise at both the regulatory and legislative level. The last thing, this is my final point, I promise. There is no evidence after 30 years of these programs that that distributing unused syringes to individuals causes more people to use drugs than otherwise would be using drugs. This is serving a population that is already using. They are already addicted to substances, and we're just trying to keep them safe, keep them from infecting other people, give them a chance at recovery. That's all I've got. I really turn it over. I'm not a public health professional. I'm just a lawyer who has the gift the governor has given me to try to help people in this state every day. And I'm going to turn it over to Ann Seitz, who is a public health professional. Thank you for your time.
Thank you.
Good evening. I hope you can hear me okay. A little closer.
A little closer.
Okay. Good evening. Is that better? Okay, great. Good. I'm Ann Seitz, as Gordon mentioned. I'm glad to be here this evening and speak with you around syringe service programs as well as harm reduction. As was mentioned, I'm with Maine CDC. I'm the director of the Infectious Disease Prevention Program, and this is the program that monitors, prevents, and provides treatment relative to HIV, STDs, viral hepatitis, and then we have the harm reduction program embedded within our program as well. And it's the harm reduction program that oversees the certification process and is obligated to enforce the rules relative to SSPs. So thank you for this opportunity. And let me pull up the presentation. Here we are. Okay, so what is harm reduction? Essentially, these are actions taken to reduce harm, reduce risks associated with certain behaviors. You can think about a Band-Aid, you can think about sunscreen, you can think about ways people will reduce their use of cigarettes or tobacco. Harm reduction is a similar concept. It's often used in relative to substance use, and essentially it's understood that abstinence, telling a person to just stop use, is not an effective strategy. So harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. It can include a spectrum of strategies, and it's essentially based on this idea of meeting people where they are, so accepting them and their drug use without judgment and or pressuring them to change their behavior. It's addressing the conditions of use along with the use itself. And it builds leadership among people who use drugs and amplifying their voices, what they need to be healthy. And it's seeing the person as a whole person, not just that they're an addict or have an addiction. So the benefits of a syringe service program They provide a range of harm reduction services. So this would include, as was mentioned, access to and disposal of syringes and other drug injection equipment. So the concept is that using a new sterile equipment each time is the best practice, and that when individuals do not have access to clean syringes or unused syringes, they reuse or share syringes, which is known to lead to infectious disease transmission and other health complications. Naloxone distribution is another major activity performed by SSPs, and overdose education. So at each encounter, that client coming into the SSP would receive this range of services. They would be offered HIV and hepatitis C testing. They would be, in some cases, offered hepatitis A and B vaccination, linkage to care and referral for infectious disease care, primary care, substance use disorder treatment, and then other basic needs like housing and food. So these are support services that are discussed during that encounter, and then there's oftentimes a referral. Education on safer use, this idea of using clean works each time, and then a major activity of recent is wound care supplies, that persons that are injecting drugs often have open wounds, and they need this basic access to healthcare services around just wound care. So they'll be able to access clean bandages and other ways to keep those wounds clean. So what do we know about substance use disorder and overdose here in the US? It's very clear that the opioid epidemic does not obey borders. We see overdose deaths throughout the country. In Maine, as you can see in this map, is a dark blue color, and this means that Maine in 2023 saw about 45 deaths from overdose per 100,000 people. So this is a rate. The rate, so if we had 100,000 people in this room, 45 of us would die of overdose death, or we would die from an overdose. And you can see how the states, the colors of the states are showing in this map, and where we are seeing more concentration of overdose deaths. And so Maine in the Northeast, Maine is accompanied by Vermont as having a similar rate of overdose deaths. So we are seeing a decrease in overdose deaths here in Maine. This figure shows data from 2023. It's from 2022 up to 2025 by month. And in this, what we see is that, and this is according to the Maine Drug Data Hub, which is a website you can access all this information. Fatal drug overdoses decreased by 16% in Maine into 2023 compared to 2022. So in just 1 year, 16% decrease. And really access to naloxone, education, interventions, such as what's provided through SSPs, is felt to be part of the success here that we're seeing in Maine, and really important intervention that's available. So substance use treatment, what we know about people who are using SSPs, using syringe service programs, is that they're 5 times more likely to enter substance use disorder treatment. If you visit an SSP or speak to dedicated individuals that run SSPs, they will tell you the individual stories, the touch point that they had with their clients that eventually led to that person saying, "I'm ready, can you help me?" And this is just a phenomenal opportunity to make a difference in that individual's life. They're also 3 times more likely to reduce or stop using drugs. So SSPs provide a gateway by which we can change the pathway for these people's lives. And there's no data to suggest SSPs increase substance use. So I'll just touch on infectious diseases now. So this chart shows the reportable diseases, particularly acute hepatitis C, chronic hepatitis C, as well as HIV by county. And Androscoggin, thankfully, is that first column. You can see, compared to other counties, just for these first 6 months of 2025, Androscoggin has the 4th highest rate of hepatitis C, and the third highest, the incidence of hepatitis C and the third highest incidence of HIV. So we know that these conditions exist here in the community, and these diseases particularly are transmittable if there is an opportunity to be exposed to blood that contains these diseases, and injection drug use and sharing of injection drug use equipment is a mechanism by which that transmission can occur. I think you know that we have been responding to an outbreak in Penobscot County relative to HIV as well as hepatitis C. This chart shows data as of the middle of October. We've since updated our data. We have now 30 individuals, 30 people who are diagnosed with HIV as part of this outbreak. All persons associated with this outbreak either have reported to us that they had used injection drug use within the last 12 months prior to their diagnosis, or that they were living unhoused in the 12 months prior to their diagnosis. And in many cases, both conditions exist. They have used injection drug equipment as well as have been living unhoused. 29 of the 30 are co-infected with hepatitis C. So we recognize that the conditions that exist for individuals who are injecting drugs, who may be unstably housed, it's an opportunity for transmission for diseases such as HIV, viral hepatitis, STDs, that this is the opportunity where we have to reduce the potential harm and impact their health by increasing their access to syringe services. This goes over the risk factors associated with acute hepatitis C. So as I mentioned, what we see here in Maine, about 60% of those diagnosed with acute hep C report history of injection drug use. 48% report having used other drugs. We know that there's certain age populations that are at higher risk for hepatitis C. 5% of case patients were baby boomers. Receiving a tattoo by an unlicensed professional, and then having been incarcerated. These are the major risk factors we see for hepatitis C here in Maine. And Maine has a very high rate of hepatitis C. We're the third state in the nation that has the highest acute rate of acute hepatitis C since 2019. We'd really like that to not be the case anymore. There's something to be said about Maine and how it's one big community. I've heard, I'm not from Maine, but I have heard this many times. You know, everyone knows each other in Maine. And I think that this is an important factor to consider, particularly as Androscoggin County has many rural communities, and Lewiston-Auburn area is the metropolitan service area for the county. So people who inject drugs are at increased risk of hepatitis C as well as HIV. And living in a rural area increases the likelihood that someone will engage in riskier behavior, like reusing or sharing needles or works. And in Maine, there's been a study to show that people who inject drugs in rural areas face barriers to accessing an SSP. And they're likely less likely to dispose of their used syringes in sharp containers. So this is a study that looked at this behavior in rural areas, and we can see that the propensity for this risky behavior increases if they're living in a rural area. Having services like a needle exchange, like an SSP, accessible to communities increases the likelihood that individuals participate in safer behavior. And that we know that organizations that can provide services like testing for HIV and hepatitis C, naloxone distribution, and general education, that this can benefit not only that drug user using population, but others in the community. So what is the role of the SSP? It really helps reduce the incidence of HIV and hepatitis C. We've seen this, that SSPs, where SSPs are operating, it can reduce the incidence of HIV and hepatitis C by 50%. They're offering sterile syringes and equipment. They're offering testing and linkage to care to catch health concerns early on. They reduce healthcare costs. The estimated cost of treating one person living with HIV across their lifetime is about $500,000, and the estimated cost of providing healthcare for all people living with chronic hepatitis C is about $15 billion annually. So these are healthcare costs that are entering into our economy already. Just to highlight what we've seen across the country relative to outbreaks among people who inject drugs, there was an HIV outbreak in Scott County, Indiana, and it's only after the introduction of the SSP, and there was a coordinated effort on this in Indiana, where they had to pass special legislation to allow for this, this emergency to be responded to in this way. You'll see that the HIV clinic opens and the SEP begins, syringe exchange program begins in Indiana. It's at that point that there was a major drop-off in what we were seeing in incidents for HIV. So we saw that the SSP was able to provide a method by which to reach the population in need of these services. There was an opportunity to offer clean, sterile syringes, and then also it was able to leverage that platform to offer testing and identify those at risk to make sure that they could access treatment and or preventive treatment. When we are speaking in communities, it's very often that there are concerns raised around syringe waste, so I do want to touch on this. So here in Maine and in many other places, there are opportunities to support a safe syringe disposal. There have been studies that have looked at this as well, comparing two cities, one with a syringe service program, one that did not have that same program, and found that the city without the SSP actually had more improperly disposed syringes. So they found more syringe waste in their community. And another study found that receiving syringes at an SSP resulted in fewer improperly disposed syringes. So key strategies can include community cleanup, education, and in Maine, it is allowable for there to be a household disposal process of used syringes, using something such as a laundry detergent, plastic container, using that to drop the used syringes, sealing the cap and then taping it, and you mark it appropriately. This is acceptable in Maine as a strategy by which many households are generating syringe waste at this time, not just persons who are using drugs. So what is the risk of infectious disease transmission from a needle stick? If someone is accidentally pricked by a used syringe, the risk of HIV transmission, if HIV is present on that syringe, is less than 1%, 0.3%. And this, even with that risk, there's a post-exposure prophylaxis medication that can be taken within a period of time after that prick that significantly reduces the risk. Essentially, it comes down to no risk. Like if you take the post-exposure prophylaxis medication after a accidental prick, then your risk of HIV essentially goes to zero. If there's hepatitis B risk, this really depends on not only the person who has been pricked, their vaccination status, so what protective factors they have available to prevent that transmission, as well as whether there was hepatitis B on the syringe itself. So if it's someone who has not been hepatitis B vaccinated and there is an active hepatitis B infection, the risk of that transmission of hepatitis B is about 31%. If that person has like an inactive hepatitis B infection, the risk of transmission there goes down to somewhere between 1% to 6%. And then hepatitis C transmission risk, if present again, is about 2%, and that 95, the vast majority of hepatitis C infections can be cured, so it's treatable, and a person can clear their infection if they complete this treatment. So SSPs in Maine, thank you, Gordon, for leading this up. We have 11 organizations that are active right now in delivering syringe service programs. They operate 19 sites across the state in 11 counties. And this map shows you where they are located. I know my colleagues from Spurwink are are here, and they deliver services in Lewiston. And so you can see that there are large areas that do not have an SSP in the Androscoggin County area, and then in this western Maine area, you can see the other communities where there are SSPs. So what are the types of SSPs in Maine? So as of the time I prepared this presentation, these 19 sites, the majority are brick and mortar sites. And what that means is that they have an established office, an established venue for where they deliver those services. And then some are mobile sites. And both of these site types are fixed locations. It means that if it's a mobile site, it's not actually in a building. They can set up outside, but they don't roam freely. They have to establish where that mobile site will be, and typically that is alongside of a formal agreement with the place where they're going to be setting up that outdoor place for providing SSP services. As was mentioned earlier, we have proposed rules. These rules are in response to the legislature and the law that was passed at the last session, and that this rule particularly allows for SSPs to operate within their approved municipality without needing new certification. And they're able then to deliver services more fluidly, and it allows for a more true needs approach, and particularly a mobile approach where they can provide delivery services, they can deliver services in more of a roaming manner. These rules are not yet in effect. We are in rulemaking. So we are obligated not only within our responsibilities around certification, we are obligated to report annually to the legislature. So the last report was delivered in 2024. You'll see here the total number of enrollees. So these are individuals who are accessing syringe service programs has increased greatly, and we note the increase in 2024. Just looking at our data now for 2025 in the first 6 months, we seem to be about on par with what we saw in 2024, and we recognize that that was a big jump from the year prior. SSP enrollees, there's no deduplication of individuals across SSPs. So a person can go and receive services at many different SSPs. So when we say enrollees, these are opportunities for individuals to receive services, not necessarily unique individuals. So 15,000 individuals were supported by SSPs in 2024, and we're seeing about the same in this year. So we feel like this is a success. SSPs are reaching more individuals that need these services. So Maine CDC, as the public health agency, really relies on the public health community, including the federal CDC, to understand kind of what is the best practice around syringe services. And needs-based distribution is really the best practice that is promoted. Why? It creates trust and is empowering. It decreases the reuse and sharing of syringes. Evidence has shown us that restrictive syringe access has led to outbreaks of HIV, and that evidence does not show that an increase in access to syringes will lead to unsafe syringe disposal. And it's particularly important for rural communities. So the practice here in Maine, which has been mentioned, is the 1-to-1 plus, is how we refer to it, which means that a person can come in, there can be a conversation around how many syringes they need, and there are many factors relative to that. It might be the distance that they have to travel to come to the SSP. It may be that they're supporting others in accessing syringes. Up to 100 syringes can be distributed. And then I mentioned referrals. This is really a critical service that is provided by SSPs. That is part of this encounter, this conversation that takes place. So you'll see here the most common referral type as per our 2024 report was for basic needs, general assistance, housing, and food. The next is peer support. This is the idea of like being able to talk with a peer that is a peer recovery coach, a peer navigator that can help them think about their services and what their needs are. Naloxone distribution was the third highest, followed by wound care and then other activities. So this is a critical component of what SSPs are doing, and this is how the intervention actually happens in these conversations about the client's needs, and for the client to express what they would like, not necessarily what the SSP would like. It's really based on the client's needs and the client's, what they put forward as their priorities. What do we see for syringes exchanged in a year? And this is across all our programs for 2024. We had over 3 million syringes distributed. So these are sterile syringes that were distributed, and then 2.5 million, so just short of the 3, were collected and disposed of. And as was mentioned, the SSPs are required to have, as part of their service package, an agreement with an official OSHA syringe disposal type agency. So they're able to do that in a very in an appropriate manner. So syringe waste concerns, this has been raised throughout Maine. As was mentioned, Lewiston, Bangor, and Portland have community sharp disposal containers. Many communities, I believe, have this. There are some barriers associated with this. The location of the containers may not be easily accessible, or may be in a location that the user may not feel safe accessing. Portland has implemented a needle redemption program utilizing their resettlement funds, and the pilot program has showed a very strong return. So they have had an increase in the number of syringes that are returned to the syringe service program, and then they just presented on this information, and they're now renewing that program and looking to continue to offer the redemption. I think they pay 10 cents per syringe, if I recall correctly.
To a cap per month, per week.
Per individual, per month, per week. So it's very regulated in that way, but they're seeing a really strong community participation in this. Some municipalities, such as Bangor and SSPs, have call lines for syringe waste pickup on public property, and this may be a barrier around consistent funding and capacity. And SSPs distribute, it's part of our work that we do distribute sharp containers for home disposal. And this is how the syringes that are being turned back into the SSP are collected. Typically, they come in within a sharps container already. And of course, the barrier there is that sharps are, the containers are expensive. These are some resources also in the presentation. In the notes field, we added all the citations to be able to, allow for more reading for if you want to dig into this. These are the major partner organizations and other agencies that provide some information on SSPs. And then my contact information's here. Before I let you go or turn to questions, I just wanted to highlight the other handouts that are part of your packet. There were 3 fact sheets. One is on SSP accessibility. And really what's very important here to emphasize is the opportunity to collaborate with SSPs, with substance use disorder treatment facilities, with community partners that are involved in the trusted relationship that can be built with people who inject drugs. And that would allow for there to just be a responsive method by which SSP services can happen here in Auburn to meet the residents of your community and their needs around sterile syringes. Another fact sheet talks about syringe distribution, and here emphasizing again needs-based distribution means providing individuals access to the number of syringes they need to be able to use a new syringe every time they use. And the question has come up, like, do they really need that many? Like how, and I think what's really important here to emphasize is that what's known about heroin and the frequency of use around heroin may be about 3 times per day, maybe the average. What we're seeing for the frequency of injection in fentanyl is far higher. And I believe in other meetings, persons who are working with clients in substance use disorder treatment mentioned, 20 times a day is not unusual. So it's really important to think about the needs-based strategy. And the final fact sheet talks about syringe waste. and emphasizing here the roles SSPs play in supporting the reduction of syringe waste and the proper disposal of syringes. And that, the use of sharps containers, the redemption program, public kiosks or community cleanups, these are mechanisms that have been shown to be effective. And, if this is something that the City of Auburn would like to consider, there are many opportunities to learn from your colleagues in other municipalities. So thank you, and we're happy to answer questions.
Are there any questions from the council? I have a few follow-up questions on the point you just made about the frequency of injection. So I've been asked by members of the community this same question, right? Why does somebody need 100? So that seems to be part of the answer, but what is the experience of SSPs regarding the frequency of visits? Users don't necessarily come every day. Is that correct?
I would say that's correct. I don't collect, we do not collect that data to understand the frequency of enrollees and their visits. Certainly our SSP colleagues could tell us better. My understanding is that it may be once a week for some users, it may be once a month for others. I think it's variable, and again, it may be relative to factors of their individual, like they live so far. It may be relative to what the stage they're at in their use and their path and their addiction and sobriety. I feel like my understanding is many different factors at play.
I think in the annual report that there is some data regarding average number of visits per client. Now, I say that it might be that it was in previous reports, but we do have some data on that, because it's just an average, so it really wouldn't tell you. I mean, it could be somebody that does come in every day. The best thing that I've heard is we had Dr. Paul Vinsel, who is a doctor with Spurwink, who works in the jail across the street, does about 15 residents in that jail with medication. And he's an extraordinary physician, in my opinion. He spoke to the Lewiston Council to this very issue and explained why in 2025 a person might be using 7 to 10 times a day, and it's partly because of fentanyl is very fast acting. So your high is like, again, this is from a lawyer. What do I know? I'm only regurgitating what Vinsel said. But I thought he was so good that evening. And that's because the high is short and intense. That's one reason why we lose as many people as we do, because we can't get there quick enough. But it's also why they frequently now, one of the reasons that the fatalities are decreasing is that they fill the product with sedatives so that it, in fact, including xylazine, which you may have heard about, it was a tranquilizer for animals, because it lengthens the high, you see. But the less fentanyl you have in the product, the more likely you might live. So, but I thought Dr. Vinsel did a wonderful job of explaining why a person might use 10 times a day if they're, in severe substance use disorder, and in a given week, that's 70 syringes. And understand too that we want them to use an unused needle every time they inject in a different site in their own body.
Mm-hmm. Needle
and frequently needles will break off, they'll get dull, so on and so on. So a person in a single injection might use 3 syringes. So again, I've been blessed. I'm not in recovery. I don't really have firsthand experience with this, but I thought Dr. Vinsel was very convincing as to why it is that a person might need that many needles. But I still think in most of our programs, I'll be honest with you, that it's quite unusual to walk in and get 100. Sometimes it's just the supply. We don't have that many. And we have a new program that opened up in Central Maine, Augusta, that's doing a 1-to-1 exchange. That was their preference. Wabanaki up in Bangor is fairly new exchange. They do 50. So it would be wrong to just assume that you walk in, you get 100 and you walk out. It's a lot more to it than that.
And I'm happy to check on that question.
I think we've got some data.
And just so I'm clear, when SSPs are certified in a community, they're certified to operate there. That has no connection to the consumers of the SSP services. So an example, Spurwink is in Lewiston, but somebody could be coming from Leeds, because that happens to be the closest SSP to them.
Absolutely, yes.
I did, Mr. Mayor, want to clarify something that your counsel said. It has to do with certified and uncertified exchanges, because once the legislature, 4 or 5 years ago, decriminalized the possession of hypodermic syringes, that made it possible, of course, to operate an uncertified exchange. Now, I don't know presently that there are any. Now, they don't get any money from us, but again, for 20 years, none of the syringes got any state funds. They operated with private funds. Now, we do give them a modest amount of money to operate, but only if you're certified. And there have been, from time to time, non-certified programs. And we've always encouraged those operators to, in fact, get certified. And in the 2 primary instances I'm familiar with, both of them did. We've also had to uncertify some programs. It happens. So, but I did want to make clear that, just because, there can be uncertified exchanges going on.
And just to make sure I'm clear on that, if it's an uncertified exchange, the regulations such as inspections and record keeping and that, they don't necessarily have to comply with those, correct?
That would be right.
And then to follow up on your comment about the decriminalization, syringes are readily available now, right? I could walk into Walgreens and buy them or order them on Amazon and have them delivered to my house. Of course, the benefit of the SSP is to drive the harm reduction by be able to easily get them for their use.
Sure.
And then I just wanted to ask one other question. A comment was made about the proposed rulemaking and the issue around schools. And I found that in the draft rules especially problematic because it seemed like there was no actual risk analysis basis for schools, because lots of, it seems like the point was that there was some elevated risk because it was in 1,000 feet of a school where an SSP was operating, but there's many, many other places, before school, after school programs, recreational programs, daycares, none of that was encapsulated in that. And it seems, at least in an area like Lewiston and Auburn, especially problematic because you could virtually close all the areas in the downtown area where we tend to see, especially unhoused people with substance abuse disorder, with an inability to service them in any of the areas where they congregate. So I'm not saying I have an answer to this. I'm just saying that was very confusing as feedback, very confusing in the proposed rule as the basis for some type of separation from a school. Any other questions that Councilor Walker?
Yeah, I'll try to keep it within the line of this, but I got a couple questions that I'd like to ask Number one is, I was listening to you when you said the number of deaths in, I guess, what we would call the whole area in Maine here. I really doubt that that number is 100% true. I think there's a lot of deaths that go on that aren't recorded, or at least it looks like when you try to read the paper after you see a death that happens in a park or in a location of the city, nothing ever comes out that someone has overdosed. And I know right here in Auburn, we've had a couple in the last couple months, right in the park next to the Little Androscoggin River. It's like it's almost a secret that the cities don't want anyone to know that somebody's overdosing around the area. Number two, over the past 2 or 3 years, I have sent quite a few different pictures to the City of Auburn, finding these needles everywhere. And if you wanted to take a flashlight and walk the walkway next to the river, you probably could find 200 down there somewhere tonight. There is nothing in any of this that you or the governor or anybody else says that we have somebody that will pick these up. We have the local police department, they don't want to touch them. We have the public works, they don't want to touch them. Before that, we had a parks department that hated to even be sent out to a park to look for them, never mind pick them up. They're everywhere. And because you people can hand them out like handing out lollipops, they don't feel that they need to bring them all back to you. And I don't know what they're doing with them other than returning them or not returning them. But I think there has to be a mechanism in your SSPs or whoever gives that authority that if people are coming back and they're not bringing them back, they must be somewhere else. Your number was there's about 500,000 that hasn't been returned. That's a pretty big number, especially when you're talking next to a school somewhere that we're finding 100 or more laying around on the back steps somewhere. So I think if I'm going to agree that we should have an SSP's place here passing them out, there has to be something more to it than just allowing you, especially when there's 2 hospitals across the river that these people from the state of Maine should be working with, and that's where this stuff should be happening, not open up a corner store down here on Main Street in Auburn or up on Center Street. So that's just a few of my thoughts.
I want to just...
Oops, sorry, go ahead.
Yeah, we're very sympathetic to what you've said. I said earlier that we don't want syringes littered and disposed of improperly, because there are a lot of ways now to dispose other than to bring it back to the program. We said there's syringe containers, shops containers, and so we hope that as many of those 500,000 that didn't get back to a program were properly disposed of. Now, we know that some of them weren't, and that's why each municipality, Augusta, Portland, Bangor, have come up with their own approaches to deal with that. But I want to go back to the issue of deaths. I would agree with you completely if what you had said was that the numbers are inaccurate with respect to overdoses that are not fatal. And that's because we have lots of private saves. 95% of people who overdose today in Maine survive. So we lose 5 out of 100. Now that's partly because of naloxone. It's partly because of the tremendous work that our responders do. Sometimes a person doesn't overdose enough. They overdose, but not badly enough to die. But in any case, when they are fatal, because those are all cases that go to the chief medical examiner's office, and we get toxicology on all those cases, we know where every death is and whether or not that death was a result of drugs. Now, that we might not know for a bit of time, might take 6 weeks for the toxicology to come back. But the one thing that we do well, I could bitterly complain about some of the lack of data that we have on treatment and a lot of things, but we have exquisite data on fatal overdoses, and we have an overdose panel that does a deep dive into individual cases, looking at thousands of cases. In fact, we looked at the case of the 15-year-old boy that died in your city maybe 2 years ago, because we looked at 3 adolescent cases. But on Monday morning, I know how many people have died of an overdose the week before. It happened to be, so this morning I was told we had 9 deaths last week. We averaged about 8. It sounds terrible until you realize that, 3 years ago, and we were having 15. So we had 20% down from last year, which was 23% down from the year before, and as Ann said, we were 16%. So we're probably down 40%. We're getting down to pre-pandemic numbers. But on Monday, I know how many people have died. On Wednesday, I know where they died, to our knowledge, what they died of without toxicology, their age. Our average age now is 47. That surprises a lot of people. And that, even in my 7 years of doing this work, that's increased from age 41 to 47. And it's not because so much that there's more seniors dying, although 2 weeks ago there was an 86-year-old. I mean, people don't expect that. But it's that actually we're losing fewer younger people. But on Wednesday, we have 25 people meet to talk about all the metrics that we follow. We look at whether they just got out of jail. Did they just get out of a hospital? Now that we actually treat residents of the jail, there's way fewer people that overdose when they get out of jail. And then on Friday, I get a written report on that. And then at the end of the month, we wrap that into a monthly report. And 30 days later, you can see all that data on the Maine Drug Data Hub. So tonight or tomorrow, we'll be looking at the report that will go up for September. So we're within 30 days, everybody, the public has access to all that. Now, the only thing you don't have is obviously names. And we only report by counties, not cities. So it's likely that your own police department has numbers for Auburn that I could get, but that we don't publish those because, again, we don't even publish the numbers for the city of Portland. So we prefer to publish all the data by counties. And when I say that we've got a 20% reduction, I'm always acutely aware that that reduction isn't 20% in every county, of course. There are counties that do better than others. Just by population, most of our overdoses, Cumberland, Penobscot, Kennebec, Androscoggin. But that's just based upon your population. It doesn't mean, we look at, is your overdose rate as a percentage of the total consistent with your population? And generally, Androscoggin pretty consistent with that. So again, not here, like I say, to steer you one direction or the other, but I do understand that it's syringe waste that really gets the public interested and involved. And you cited this is, as you prepare an ordinance, if that's what you decide to do, we have been talking with the city of Lewiston, having this issue of having the service available where the clients are, recognizing that many of the clients are experiencing some degree of homelessness, versus putting it out on the outskirts where they can't get to or would have to take a bus. Where that center is where the businesses are, is a real balancing act. And they're going through that in your neighboring city right now, is that a lot of people don't want the program right, what I would consider downtown. And yet that is where the bulk of people who are the clients are. And it's a balancing. I admire what you're trying to do. I can't tell you how many hours that your colleagues in Lewiston have worked on this issue. We've been there at 11 o'clock at night, they are really trying to achieve that balance. And I admire the work that you're about to do. And you'll get it right for your community. Not every community is the same.
Other, Council Gary.
Thank you, Mr. Mayor. From what I heard, not every overdose can be resuscitated by taking Narcan, because there's always a flux that comes through the state that's it's tolerant of, Narcan has no effect. It's another drug component that people have to watch out for. And I'm not a proponent for taking drugs. I'm for a person's free agency. If they're going to do it, they're going to do it. But what I would like them to try to do is know their source and to try to keep track of where they're getting their stuff from, so that if something, heaven forbid, happens to them, that somebody, somehow, whether it's our firemen, the police department, people at the drop-in center, anywhere, can revive these people, because every life is a precious life, no matter their circumstance in life.
I couldn't agree more. We do have 4 drug checking machines now in Maine. It's fairly new, so that there are 2 or 3 places where in a syringe program, there's a sophisticated machine paid for by a grant that Maine Health has. And so for the first time, people can actually bring in and have it tested as to what's in it. It's so new. It's matter of a few months, but you're right. We would hope the same thing. If they're going to use, that they have good information on what they're using. And you're also right that naloxone, brand name Narcan for the nasal spray, is remarkably, it's a miracle drug if you're overdosing on an opioid. If you're overdosing on cocaine or meth or a combination of these things, no, it has no impact. And so we still use it thinking that, well, now a lot of the cocaine and meth has some fentanyl in it, so it might have some impact. But it's also the problem that, honestly, we have these tremendous medications now that really help people with getting into recovery with methadone or buprenorphine. We don't have those same effective medications, frankly, for amphetamines, meth and primarily meth and cocaine. So it's complicated, but again, I think we're doing much, much better in terms of breaking down the stigma and having more options for people. So I'm very proud of what we've done, but we're still going to have 400 people die this year of drug overdoses, and that's more than one a day. And in the state of Maine, that seems like we should be able to do better.
Other questions from the council? Thank you very much, Mr. Stockford.
Sorry.
I do have one. Go ahead.
Sorry.
Council.
Slow to the trigger. Do you all have some ideas or examples to Councilor Walker's point in terms of collection programs and the challenges thereof? Have you seen successes that you could share with us in terms of innovations that we might want to think about implementing?
Absolutely. I frankly love what they've done in Bangor and Portland, and we're happy to share that with you. Absolutely.
Any further questions for Mr. Smith and Ms. Sykes? No. I do have a follow-up question, Mr. Stockford, based on follow-up from a comment that Council Walker made that we shouldn't allow these in Auburn, but my understanding from your comments are that there's probably no basis for the city to outright prohibit SSP certified by the state from operating in Auburn pursuant to the current statute and rules. Is that correct?
Yeah, I would anticipate the potential for a legal challenge on that. And, we can if that's something the council ends up looking at, we can do a more exhaustive analysis of it. But there are potential legal challenges that type of ordinance would face.
Great, thank you. Anything further on this issue? We have 2 executive sessions, but we have a very short agenda. We'll take those up at the end of the regular meeting, and the council will be in recess until 7 p.m. The November 3rd, 2025 Auburn City Council meeting will be called to order. Please join us in the Pledge of Allegiance. Thank you. If we could have the councilors introduce themselves, starting with Councilor Gary.
Thank you. Good evening. I'm Belinda Gary, City Councilor at Large.
Good evening, I'm Rick Whiting, Ward 1 City Councilor.
Good evening, Tim Cowan, Ward 2 City Councilor.
Good evening, Steve Milks, City Council, Ward 3.
Good evening, Jeff Hyman, Mayor.
Good evening, Ben Weisner, City Councilor, Ward 4.
Good evening, Leroy Walker, Councilor, Ward 5.
Good evening, Adam Platt, City Councilor at Large.
Phil Crowell, City Manager.
Thank you. The first item on the agenda tonight is the consent agenda. There's one item on the consent agenda appointing Tara Parody as a member of the Ethics Panel. Is there a motion?
Motion to move.
Moved by Councilor Walker. Is there
Second.
a second? Seconded by Councilor Cowan. The vote will be by show of hands. All those in favor? Opposed? 7 having voted in the affirmative and none in the negative. The motion is adopted. The next item is approval of the minutes of the October 20th, 2025 regular City Council meeting. Are there any errors or corrections? Not seeing any. Is there a motion to accept the minutes?
Motion to accept.
Moved by Councilor Walker. Is there a second?
Second.
Seconded by Councilor Cowan. The vote will be by show of hands. All those in favor? Opposed? 7 having voted in the affirmative and none in the negative. The motion is adopted. The next item under communications, presentations, and recognitions is the proclamation for Extra Mile Day, and then we'll have an Extra Mile Award. I'll read the proclamation. Whereas Auburn, Maine is a community that acknowledges that a special vibrancy exists within the entire community when its individual citizens collectively go the extra mile in personal effort, volunteerism, and service. Whereas Auburn is a community that encourages its citizens to maximize their personal contribution to the community by giving of themselves wholeheartedly and with total effort, commitment, and conviction to their individual ambitions, family, friends, and community. And whereas Auburn is a community which chooses to shine a light on and celebrate individuals and organizations within its community who go the extra mile in order to make a difference and lift up fellow members of their community. And whereas the City of Auburn acknowledges the mission of Extra Mile America to create 550 extra mile cities in America and is proud to support Extra Mile Day on November 1st, 2025. Now therefore, I, Jeffrey D. Harmon, Mayor of the City of Auburn, do hereby proclaim November 1st, 2025 to be Extra Mile Day. I urge each individual in our community to take time on this day to not only go the extra mile in her own life, but to also acknowledge all those who are inspirational in their efforts and commitment to make their organizations, families, community, country, and world a better place. And we will present the Extra Mile Award this year, if Larry Allen can come forward. So here in Auburn, we know that when individual citizens go the extra mile in service, it strengthens and uplifts our entire community. Each year on November 1st, National Extra Mile Day, the City Council and I believe it's important to shine a light on those individuals and organizations who truly go the extra mile to make a difference and lift others up. This evening, the City of Auburn is proud to recognize Larry Allen, Transportation Director and Transit Program Manager at the Androscoggin Valley Council of Governments, as this year's Extra Mile Award recipient. Larry oversees the Androscoggin Transportation Resource Center, coordinating transportation planning across the Auburn-Lewiston area. He also provides administrative oversight of the CityLink bus service, working with the LA Transit Committee and its contractors to manage and improve the local transit services. It's Larry's exceptional dedication to that work that brings us here tonight. Recently, during a major transition in the transit providers and the scope of services, Larry navigated the change with professionalism, calm leadership, and an unwavering focus on customer service. According to Amy Landry, who joins us here tonight, the executive director of AV COG, she said, Larry has been instrumental in implementing the most recent transit study recommendations on behalf of the Lewiston-Auburn Transit Committee. He demonstrates a deep personal commitment to the success of the CityLink system, consistently striving to provide exceptional service to both cities and to the riders who depend on it. His professionalism and unwavering dedication through this process have been remarkable. We couldn't agree more. Larry's efforts have directly improved the daily lives of Auburn residents who rely on public transit. And so it's my great honor to present Auburn's 2025 Extra Mile Award to Larry Allen. Also on this
Mayor?
agenda item, we have a communication from the city clerk reminding residents of Auburn that tomorrow is election day. There's 2 state referendum questions and the general municipal election for mayor, city council, and school board. All the polling places will be open from 7 a.m. Till 8 p.m. Wards 1 and 2 at the Senior Center, 3 and 4 across the hall here at the 2nd floor of City Hall, and Ward 5 at the Boys and Girls Club in New Auburn. And for those that still have an absentee ballot, they can drop their absentee ballot in the drop box between City Hall and the parking garage until 8 p.m., or bring it inside to the clerk's office and provide it to the clerk by 8 p.m. Absentee ballots are not accepted at the polling places. And for new voters, they can register at their polling place tomorrow and then vote.
Mr. Mayor, at appropriate time, could we please recognize our student representative?
Sure. I didn't see you come in. Can you introduce yourself to the public?
Mubarak Abdullahi, student representative.
Great. Thank you. Thank you, Councilor Gary. We'll move on to the first open session of the evening. So if there's any member of the public that would like to address the council on any item related to city business that's not on tonight's agenda, please approach the podium and provide your name and address.
Hi, Richard Nadeau, 211 Eastman Lane. I addressed you guys a couple of months ago. I wanted to provide an update regarding my ongoing efforts to acquire the parcel adjacent to my property at 145 Eastman. When I attended the previous meeting, my intent was to express an interest in purchasing the land as an abutter at fair market value, no plans for development. At that time, I was advised to monitor the RFQ process by you guys on the city's website, and did that. I did notice in the minutes for that meeting there was no mention that I was looking to purchase for no intention to develop, but that's not important. When the RFQ was released, I discovered it was limited to developers, which effectively excluded residents like me who wish to preserve the natural character of the area. This was disappointing, as my original purpose was to maintain the view and protect the land from development. After learning that partnering with a developer was my only option, I reached out to several well-known developers in the area, and when I approached those developers, I only asked if they were interested in partnering with me and what the cost might be. Unfortunately, most either did not respond or were uninterested in a partnership without development. Ultimately, I was only able to connect with one neighbor whose priorities were different from mine, which means I may, best case scenario, only secure a small portion of the land closest to my house. I want to emphasize that this is not about cost. I was prepared to pay market value for the land, and my goal has always been just to preserve the natural landscape and prevent further overdevelopment on my front lawn. Auburn is a beautiful community, and many long-term residents share the desire to maintain its character rather than see every available acre converted into high-density housing. Although it would be good to focus more on using the land that's already been cleared in the city's portfolio before clearing more land on the fringe of the town. I respectfully ask the council to consider creating a process that allows abutters or residents to purchase land without being forced into development partnerships before the land gets put into this situation. This would help protect the integrity of our neighborhoods and honor the vision many of us have for Auburn's future. Thank you for your time and consideration. And my only question, if I'm allowed to ask them, is if there's anything else, any other tips I could have, or any lessons learned I could have taken, or anything I could have done differently with the knowledge I had at the time I was here last time, to try to go either going forward or a lesson learned from the past.
I think the answer to that question would probably be the same as the last time, is there is a published RFQ, and the city has a very defined process to work through that, and I think the RFQ speaks for itself. The city has not completed the review of the proposals that were received, so it's unclear at this point what the outcome will be.
Okay, so I should just stay tuned?
Stay tuned.
Hope for the best. All right, thanks.
Thank you very much for coming in. Is there any other member of the public who would like to address the council? Please approach the podium and provide your name and address. Not seeing any, the open session will be closed. There is no unfinished business on the agenda this evening. We'll move on to new business. The first item is Order 1011-1032-025, granting Golden Crust Auburn LLC, DBA Auto Pizza Auburn at 730 Center Street, an on-premise liquor license. This item is for consideration and public hearing. Is there a motion?
Motion to approve.
Moved by Council Walker. Seconded by Councilor Whiting. We'll open the public hearing. If there's any member of the public who would like to address the council on the granting of this liquor license, please approach the podium and provide your name and address.
Hi guys, I'm Brian Conlon, 904 Washington Avenue, Portland, Maine. I own and operate the Auto Pizza in Brunswick and Sanford, Maine, and I'm very excited to have the opportunity to reopen the Auburn location as well. So thank you for your time tonight.
Great,
I really
thank you very much.
Thanks.
Is there any other member of the public that would like to address the council on this item? Please approach the podium. Not seeing any, the public hearing will be closed. Discussion by the council? Yeah,
No discussion, I just wanted to make a comment. Just wanted to acknowledge kind of the tragic circumstances with which this change is happening, and just thank you guys for putting an interest in Auburn and working to establish a new business here.
Are there other questions or comments from the council? Is the council ready?
I wasn't a close friend of Greg, but I did work with him years ago, and I really appreciate the comments on that. Thank you so much for that.
Thank you. Is the council ready for the question? Vote will be by show of hands. All those in favor? Opposed? 7 having voted in the affirmative and none in the negative, the motion is adopted. The next item is Order 1021-1032-025, approving the temporary needs and impact analysis for 95 Main Street, 4th floor, to be utilized as a temporary and limited public safety facility for the City of Auburn Police Department Criminal Investigations Office. As background for the public, there is a current city ordinance that requires needs an impact analysis to be performed for any newly established public safety facilities in the city limits, even if it's temporary. And this is follow-up from the discussion that the council's had in past meetings regarding the refurbishment of space here at Auburn Hall for 911 and the need to move the Criminal Investigation Office to a temporary location while that's going on until the new public safety facility is completed. Is there a motion?
Motion to move.
Moved by Councilor Walker.
Second.
Seconded by Councilor Wisner. If there's any member of the public who would like to address the council on this item, please approach the podium and provide your name and address. Not seeing any, public comment is closed. Discussion by the council. Councilor Geary.
Thank you, Mr. Mayor. Are they going to be utilizing that whole office space, or could they use part of it, and could another agency or department of the city also take over half of it?
Mr. Manager.
We're currently not using the entire fourth floor. It's only a portion. It's the same portion that was used with the business and community development. So they will need to have that entire space based on the size of the unit moving in there.
Other questions or comments from the council? Council Whiting.
I just had a comment. I noticed this was a subject for the planning board, and I appreciate the explanation you gave, Mr. Mayor, that it's related to creation of, public safety facilities. In the interest of efficiency of operations in the future, it would be nice to see like routine office uses not have to go before the city council and the planning board. It seems to me that could be an administrative review. I know it was written in that way, but this is just an office use. This isn't like a police force, taking over office space. This is just one office space being exchanged for another. So it seems a bit bureaucratic to have to go through this process. So I would hope we wouldn't have to do it in the future if we could make a simple amendment to whatever ordinance we created that requires this.
Other questions or comments from the council? Council ready for the question? Vote will be by show of hands. All those in favor? Opposed? 6 having voted in the affirmative, 1 in the negative. The motion's adopted. Council Whiting?
Thank you, Mr. Mayor. I would propose that we I would like to introduce a motion to suspend the rules regarding a time-sensitive city council resolve related to the Androscoggin County 2026 budget.
Council Whiting has moved to suspend the rules to add an additional agenda item relative to a resolve addressing the county budget. It's a non-debatable motion. The vote will be by show of hands. All those in favor?
I'll second.
Excuse me, sorry. Is there a second?
I'll second it.
Seconded by Councilor Geary. Thank you. All those in favor? Opposed? 7 having voted in the affirmative, none in the negative. The rules are suspended. Council Whiting, do you wish to make the motion?
Yes, I would move that we adopt the city council resolve as presented from the city manager in opposition to the proposed 13.15% increase in the Androscoggin County 2026 budget. And it's well documented. I think it's very well written. In particular, in light of a 47% increase over 5 years and now a 13.15% increase. It's well beyond what most municipalities, including this one, have done in terms of budget increases over that time period.
Council Whiting has moved the adoption of Resolve 03-1103-2025, opposition to the proposed 13.15% increase in the Androscoggin County 2026 budget. Is there a second?
Second.
Seconded by Councilor Geary. As a point of information, should the resolve be adopted by the council, be presented by the city manager on November 5th at the public hearing for the county budget. Is there any discussion by the council? Council Platt.
I would just like to encourage any public that's watching who agrees with this resolve to show up to these public hearings at the county level. I know that oftentimes we find ourselves coming to our municipalities to make our voices heard, but we also have a county commission that listens to us. And so if we oppose this 13.15% increase, make your voice heard, show up at the public hearing. That's what's going to move the needle.
And for those that might want to contact the county commissioners, for most of Auburn residents, that's Andrew Lewis. For those below the Little Androscoggin in South Auburn is Jane Penethy, and their contact information is on the county website. Councilor Geary.
Thank you, Mr. Mayor. Given the lateness of this, that it was not put in the council packet, could our good city clerk put it on our website so that Auburn residents can read this and then also add their support of what we're doing and call the county building, the administrative office, and the commissioners so that they will hear this loud and clear message?
Yeah, thank you very much for that suggestion. The clerk will post this on the city website so the public will have access for it. Any other questions or comments? Council Whiting.
Another thing, I would like to highlight the discussion about the Budget Committee. I think that's really important, that the Budget Committee should have binding authority to reduce or reject budget increases that are not fiscally responsible, are supported by a majority of its members. Currently, the Budget Committee is rather weak. There's a supermajority required such that it's almost impossible to defeat any budget proposal that is presented to the Budget Committee. So it's almost a wasted exercise, and I had never been exposed to it before, and I didn't do a particularly good job, but knowing the reality of how the system works, it almost didn't matter what I had to say because it was going to pass, and we were going to be the beneficiaries or the recipients of a massive increase.
Other questions or comments from the council? Councilor Cowan.
Thank you, Mr. Mayor. I'd also like to just point out, encourage people to go on the website and look at this, but there is one clause in here that just highlights the reality that there were some costs, particularly for the sheriff's department and the jail operations that were initially funded through temporary funds, and so now that we're having to, that's being built in. I don't know if anyone has any details on the amount, but I just, it's kind of like we're hitting a cliff here, and now we're having to make up for that. And I don't feel good about us having to, and our residents having to take that on. I think the city of Auburn and the previous councils and this council worked hard not to put the city in that position. It's unfortunate that the commissioners did.
Thank you. Other questions or comments from the council? Council ready for the question? Vote will be by show of hands. All those in favor? Opposed? 7 having voted in the affirmative, none in the negative. The motion is adopted. We'll move on to reports. Several items for the mayor's report. The homeless committee meets tomorrow morning at 9:30 a.m. at the Auburn Resource Center at 121 Mill Street. Thanks to Zach Marr from Community Development. He's a member of the Maine Continuum of Care Board, which is part of Maine Homeless Planning, and he invited them to have their monthly meeting on the 22nd at the Resource Center, and they received a tour, and staff received numerous very positive comments from the committee about the work that's going on there. I was able to attend the Maine Real Estate Developers Association Fall Conference in Portland last week. Very informative meeting, and many of the things that the city's doing are clearly in alignment with their thoughts about how additional development can take place to be able to meet the goals in our housing study. I attended, as did Councilor Cowan, safety study briefing by the engineering department and their contractors, Goral Palmer, regarding Turner and Dennison Street. For one of these meetings, it was quite heavily attended. There was, I'd say, around 20 people attended. I think everyone was very supportive of the pedestrian safety changes that were outlined. The big concern, I think, among all of the attendees was the traffic movement issues there. And the outcome of that was that engineering would speak with Maine DOT to see if they would be willing to do a traffic light study for that intersection, given the high volume of left-turning traffic from Dennison on to Turner Street. The Building Hope documentary, it's a documentary film shot by some Maine filmmakers regarding homelessness in Maine, was sponsored by Spurwink and shown at the East Auburn Baptist Church. Last week, there was a really good attendance and a great panel discussion afterwards. Relative to the comp plan committee, they met last week and started the future land use mapping, which is the designation of the growth areas, and they will meet again on the 18th of November here in the council chambers for people that are interested in that future land use designations. An update on the warming center and the shelter. So there's been a lot of confusion recently about what was going to be offered and the duration, and Maine Housing has clarified their expectations with Alter LA, which is the cognizant nonprofit under Cadence Kitchen that's going to be running this. So the current expectation is they are going to be running a 100-person warming center from 8 p.m. to 8 a.m. during the month of November. On December 1st and through April 30th, that will change to a 100-person warming center that will be open 24 hours a day. And at the conclusion of the warming center on May 1st, they'll transition over to the 40-bed emergency shelter. So there's a follow-up meeting later this week that the manager and I will be attending with Maine Housing, City of Lewiston, the shelter provider, to get some more detailed information regarding the budget and their plans, so that the previously appropriated money for this in the Auburn budget can be allocated for that project. That's all I have for a mayor's report. Councilors, Councilor Geary.
May I ask a question? Will the city of Auburn be providing transportation like they did towards the end of people participating and staying at the overnight shelter? They were being able to, we bused people from there to the 121 Mill Street property. Will we be continuing that on the Wednesdays and Saturdays?
Yeah, so the current plan had been to provide the same type of transportation on Wednesdays and Saturdays from the new Horton Street location to the drop-in center on Mill Street. We were planning on starting that mid-month November, so we weren't really ready for when they decided to open earlier. We're still looking at that transportation. There may be some changes in the number of trips, as we're expecting the volume of people that will go over to the drop-in center will probably decrease some, especially on Saturdays, starting December 1st, when they are going to remain open there. But we're still planning on doing that. We're rethinking the number of trips that we might have to make.
Thank you kindly for doing all that you do for this, as well as the city manager.
Thank you. Council Whiting.
I should know the answer to who was responsible for repaving of about a mile of North Auburn Road, but whoever, whether it was the state or the city, a very fantastic and quick job was done, and I think cost effectively with the way they did it.
It's a city engineering bid? Yes, city engineering. Councilor Cowan?
Similar comment. We heard a lot of great feedback for the work that's been accomplished. I think paving is first coat is finally on all aspects of the Granite, Davis, and Hillsdale. So great feedback to pass on to the firms involved.
Thank you. Councilor Milks?
Nothing tonight?
Councilor Wiseman?
Nothing tonight.
Councilor Walker?
Thank you. The one thing that I want to get out there to the people is the Age-Friendly Committee is going to have a Thanksgiving dinner this year, November 27th, at the Senior Community Center at Pettingill Park. The doors will open at 10 o'clock a.m. Dinner will be served at noontime. We're asking for a $5 donation. If you can afford that, if you can't, you're still welcome to come to the Thanksgiving dinner. We'll have dessert, coffee, and water as always, again, at Pettingill Park in Auburn. Please come. Any age, you're welcome to the Thanksgiving dinner, but please call ahead. And that number is 333-6601, and then the extension is 2109. And please give her your name, and number would be nice if you want to give the number. Thank you.
Thank you. Councilor Platts?
Thank you. Two quick updates. First, I wanted to just bring some attention to and to thank members of the Conservation Commission, and specifically Rihanna LaRose, for work on a new pollinator garden in Bonnie Park that was put up not this past weekend, but the weekend before, so a week and a half ago. This was a pollinator garden called the I Love You Garden. It was commemorative of the shooting from 2 years ago. And what I wanted to share was that Rihanna reported that they had volunteers from all walks of life show up. There were members of the deaf community who showed up, local volunteers, as well as some unhoused folks who just stopped during their day to help out. So she said it brought tears to her eyes, and I've seen these pollinator gardens before. I think they're great for the community. So just a thank you to her and to the Conservation Commission. And second, I wanted to share a personal experience. I went to Nightmare on the Ridge up at Wallingford's on Saturday, and I just want to say it's one of the best produced scare events I've ever been to in my entire life. And it's incredible, and it exists here in our own city. So hats off, to the Ricker family that runs that. But it was just incredible. And if you haven't, I think it's over for this season, but next year it'll be back. If you haven't gone, you should go. We're lucky to have it in our backyard. Thanks.
Councilor Walker?
Sorry, I had one other thing to say. Yeah, when he said Halloween, that made me think we just did a Halloween event too in New Auburn, and we had over 525 people come through. That's somewhere around 325 kids. And I wanted to put a thank you out to everyone that was involved. They helped us put that on, as well as the city working side by side with us. It was a great event. Everything went just as smooth as we were hoping it would go, and we'll be doing it again next year.
Great, thank you very much. Representative Abdullahi?
The first thing I'd like to say is the boys cross-country team for EO has 2 players going out of state to Vermont to compete. So Harper Borden and Calvin Vincent, I'd like to congratulate them. And then the second thing I'd like to say is with the football and soccer season ending, it should leave 2 more opening, which is the indoor track and basketball, I think it is. So I'm excited to see that.
Great. Thank you. Mr. Manager?
Thank you, Mayor, City Council. Starting off, I'd just like to thank our city clerk and her team. Just so folks know, Election Day doesn't start tomorrow. It's work that they've been doing for several weeks, working. We've had an incredible amount of absentee ballots that have come in, and just a really great process that she and her team have done. And not only that, but also her and the Public Works team for the setup for tomorrow's Election Day. The city also had a very successful Fright Festival that occurred last Thursday. Despite some rain, we had a great turnout. Really appreciate the city departments, local businesses that participated in the annual Trunk or Treat in the heart of our downtown. And we really want to thank our community sponsor for Fright Fest, Home at Last Realty, who is a great sponsor for us in this event. The next downtown event will be Hilton Holiday Hangout, which will be on Tuesday, November 18th from 4 to 7. We'll have live music, shops, nearly about 30 local makers and vendors will be at that event. Admission's free, and we have a great turnout, and it's a great support of our local makers. We're still seeking participation for our Christmas parade. This will be held on the evening of the tree lighting on Sunday, December 7th at 3:30 p.m. If you'd like to apply, it's auburnmaine.gov. We still have need of some participants. Lastly, the Assistant City Manager and myself attended the ICMA conference. We had several topics of the conference that we participated in, workshops, including priority budgeting, homelessness, housing, workforce, the art of consensus building, and then some of our challenges with public meetings that many communities across the country are facing, and gave some really great best practices for municipalities that I'll share with the council at a later time. And lastly, real successful private-public partnerships that many communities are doing. We've had great success here in Auburn, but certainly areas that we can expand on. So that's it. Thanks.
Great, thank you very much. We'll move on to the second open session of the evening. If there's any members of the public who'd like to address the council on any item that's not on tonight's agenda, please approach the podium and provide your name and address.
Excuse me. Thank you, Mr. Mayor, members of the City Council. My name is John Cleveland. I live at 183 Davis Avenue, and we're delighted with the new paving on the road, by the way. But my purpose for speaking to you is I just wanted to make clear, because I don't think during the conversation of the resolution that you just passed in regards to the huge tax increase being proposed by the county, that all Auburn citizens realize that that tax increase goes directly to the city to put into their property taxes. That's how it's paid. There's no separate bill that goes out. And it's important to understand that when this council and future councils are trying very hard to hold down the tax increases, this is exactly the kind of thing that makes it extremely difficult to achieve that goal. Because more than a 13% increase in the budget makes it very hard to hold the line, and the council has no alternative but to pay it and put it in the tax bill. So it's the people, if you want your property tax rates held down, this is one of the ways you can do it. Speak up, get involved, tell the county officials that you can't afford these kinds of increases. If you're going to help us meet a goal of keeping taxes down, we need you to speak up as well.
Thank you. Is there any other member of the public that would like to address the council? Please approach the podium, provide your name and address. Not seeing any, the open session is closed. The council has two executive session items, neither of which we're expecting action after the executive session. The council will be moving directly to adjournment when they come out of executive session. The first executive session is pursuant to 1 MRSA Section 405, Sub 6C, to discuss an economic development matter. Is there a motion?
Motion to move.
Moved by Councilor Walker. Is there a second?
Second.
Seconded by Councilor Cowan. The vote will be by show of hands. All in favor? The council will be in executive session.